Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lengel. Earlier this week, you had the opportunity to listen to the Senate Majority Policy Committee, which is exclusively Republicans, talk to the mental health community about the huge crisis that we find ourselves in when getting services to the people who need them most. So what stuck out to you the most in this hearing?
Yes. Well, the first thing I would say that stuck out was it was two of the senators. So it wasn't a big meeting of the Senate majority, but it was Dave Argall, who's the chair of that committee, and then Senator Culver. And they were talking about the needs in their districts, but they had professionals from across the state. They had people like even a Supreme Court justice within the state. We had prison wardens. There were, and then the vast majority were people who are service providers for mental health. And they kind of presented this like, well, we have this crisis happening. What can we do that is cost effective? That's important, especially when you think about like the major goal of the Republican majority is to get spending under control, because we do have, it's a $1.2 billion. There's a structural deficit that if you ever walk around the Capitol, you'll see like little hard hats. They're working on the deficit. So that's the big goal, is like, how can we do this affordably and effectively? And there's, a variety of concerns coming from the mental health community about what can be done. A lot of it at this moment is a bit up in the air because of those federal cuts that were all kind of, they've been made, and we're waiting to see how that impact on Medicaid is going to trickle out to actual healthcare providers and what's going to happen.
And there's this conversation, I think, brings up a broader discussion about the way that mental illness interacts with, our homeless population and those who have substance abuse disorder, and how do we address those things? It's kind of like a chicken and an egg situation. At least that's how it's been thought of. And I don't know that that's a really fair way to think about it, but there seems to be a few schools of thought about how to address this, correct?
Yes. So I think a lot of people are looking at the homelessness problem as a symptom of mental illness. And that is a perhaps logical conclusion to draw, because especially in the 80s, when we saw a lot of closing of state mental health hospitals. And a lot of people going out onto the streets who were mentally ill, and an increase in the homelessness population. So there is that. It is harder for people who are struggling with mental illness, depending on the severity, depending on what they've got going on. It can definitely be harder to hold down a job, to secure housing, to function the same way that a neurotypical person would in society. That's all one layer of it. But there's another layer where there is also this housing shortage, and there is also a really significant economic problem for a lot of Americans right now. We are not, there's a lot of inflation. It's hard for people to pay bills. So it is not necessarily as simple as saying, well, if you treat people's mental illness, then they'll be able to get a home. Some of the people who are homeless are actually homeless because they can't afford a home. And the evidence shows that when you're living in a sort of traumatic environment or dealing with those kinds of struggles, that is more likely to trigger problems like mental illness or substance use. So like you said, it is a chicken and egg question. And it's something that I think that the advocates who were, representing mental health institutions were saying, we have to look at this from several angles. Like, we have to meet people's needs on several different levels. And even the prison wardens who are there were saying, like, this, we can't handle this. Like, we keep getting people in because they all have a behavioral issue while they're out on the street. And the only thing for first responders to do is to arrest them. And then they have people who they don't have the means to treat in county jails. It's not safe for them or for the people who work there.
Did you get any sense from Argall about where he lands on this, or where he thinks this conversation should go legislatively?
He called it a public policy nightmare. So I think that, he's like, this is a really big issue with a lot of different sides. I think there were some very straightforward, simple solutions that wouldn't, solve the whole problem, but could help, that I think they would probably take under consideration. One of I believe a doctor from Geisinger mentioned that they have a really hard time, getting the people required out to where they're supposed to be when they're serving, rural areas for mental health. So if there is a rule that they have to spend at least half the time with a psychiatrist that they are with a therapist. So if you've ever dealt with the mental health world, like psychiatrists are doctors, they usually, people will see them more briefly. They'll get prescriptions from them. They might oversee a plan that was created by a therapist, but most people spend more time with a therapist doing talk therapy or whatever type of therapy they're doing. So, having to meet that requirement of 50% of their time with a psychiatrist is like some red tape that perhaps the legislature could address, or allowing therapists to oversee their own behavioral plans. Those are things that, don't cost anything for the legislature to change.
Well, as budget negotiations continue on, we will keep up with this story. And for readers, they can follow us at thecentersquare.com/Pennsylvania.